We're going to go now to Youngstown. First guest today is Lisa Burrich. She is a registered nurse, emergency room team lead at Mercy Health St. Elizabeth in Youngstown. Thanks for joining us. We appreciate it very much.
Good afternoon, Governor.
Tell us, take us inside. Tell us what you do. Tell us what your team does, and what are you seeing every day?
I would say we're definitely in the thick of it here. St. Elizabeth's is a level 1 trauma center as well as a stroke center. We're busy at baseline, and lately we've had an influx of COVID patients. So we're dealing with all of our regular patients and then all of the COVID patients on top of that. The hospital has been at capacity, so we're holding critically ill patients here in the ER for sometimes days at a time. So we're just really bogged down.
So tell us a little bit about, are you dealing directly yourself with these patients? Are you coming in contact with the COVID patients? Tell me a little bit what you do, what your day is like.
I am. So a lot of times I'm one of the charge nurses in the ER, but I'm registering ambulances. I'm providing one-on-one patient care. A lot of times when patients come in and they're in distress, it's all hands on deck. So we're kind of all pitching in. We're all dealing with it here, and it's definitely been a tough go.
And so how are you holding up? That's got to be tough day after day after day. And how's everyone else holding up?
It's been extremely stressful. It's definitely been a long 10 months here. Like I said, we're dealing with our regular patients. On top of that, we have the COVID patients. The morale is down among staff. We're exhausted. We're exhausted physically and mentally. We're definitely leaning on each other for strength at this time.
What's the toughest part of what you do, just for you, maybe personally?
I would say one of the toughest things is having the fear every day that we're going to take something home to our own families. It's just a very scary feeling.
Yeah, that's got to be a constant thought, huh?
Yeah,
Something
definitely.
you're constantly thinking about. Wow. Yeah, I can only imagine. Tell me about the patients when they come in. What condition are they usually in when they come in, the COVID patients?
Well, we see COVID patients with all degrees of symptoms. Some of them are mild, and we're able to treat them accordingly. Other patients come in respiratory distress. They require immediate attention. A lot of times we intubate those patients right on arrival, and or we utilize BiPAP as well. But those patients need immediate intervention. So like I said earlier, it's just all hands on deck.
So I was talking this morning to all the health commissioners around the state of Ohio, and one of the things that they said that they were seeing, and it was being reported to them, is emergency response team come and get somebody at their home, and they're already in pretty significant distress. And so they thought that maybe they were seeing more and more people waiting too long to call to go to the hospital. So I don't know what could you recommend? When should somebody, they're at home, at what point, should they think about going to the hospital? Let's assume they have not reached out to a doctor, and let's assume they have not had a test, but now they're starting to have some symptoms. At what point should you get nervous about that, do you think?
I would say that any time that there's significant shortness of breath involved or any type of respiratory distress, by all means, call 911. You definitely need to be here. Mercy Health has done a great job of establishing flu clinics in the area. So we really encourage people to utilize those clinics for mild symptoms. It will definitely help us here in the ER to be able to treat the more serious patients in a timely manner. We just really need people to utilize the appropriate level of care right now.
Well, please thank everyone. Thank you for what you do every day. And anything else you want to say to the people of Ohio? We'll let you get back to work. We just appreciate it.
I just want to say, you know, this is our plea for help. We need everybody to do their part. It's not only to protect yourself and your family, but it's to help keep us healthcare workers healthy so we can continue providing care. So by all means, wear your mask, wash your hands, stay socially distanced. Just be responsible.
We appreciate it. Thank you. Thank you for the message. Thanks for what you do. We
Thank
appreciate
you.
it very much. Thank you.